Hello, everybody. So I decided to turn the camera back on. Today is surgery day, so I just wanted to turn the camera back on and come on here and let you guys know um, what to expect. I will try to bring you guys along for as much of the journey as I possibly can. If you didn't see my last video, I am having a surgery to remove a boil and abscess from my rectum area, and I never experienced this before. I do not know what to expect. If you've ever had this surgery, I would appreciate you leaving your comments on what to expect or anything like that. I have not done any research, gotten any opinions. I may do so after the surgery, but I do not want to get myself worked up over this whole situation. I'm just praying and trusting God and allowing Him to comfort me. And yeah, so I had to come and let you guys know what happened after surgery. So I recently got out of surgery. I'm not even for sure how long my surgery was. I'm not even for sure what took place as far as the surgery. The surgeon never came back out to speak with me. They sent me back to my room without me having any knowledge of what is going on. I'm very, very upset right now. I still have not heard from the surgeon. When I came upstairs, my nurse informed me that she is not allowed to let me know what took place. She knows because they told her, but here it is, five what? No, yeah, 5:20, and I still have no information as far as what took place as far as my surgery. I went into surgery at 3 p.m. and I have no answers as far as my surgery. So I'm still waiting for the surgeon to contact me. So I'm going to document the time that he finally contacts me to let me know what transpired during my surgery. So I'll come back on here and let you guys know any updates that I have. Okay, so I told you guys I would come back and give you an update about the surgery that I had today. Okay, so the surgery was originally supposed to take place at 2 p.m. The surgery did not start until 3 p.m. They took me back, gave me anesthesia. And of course, once they give you the anesthesia, you do not recall anything that took place after that. So when I woke up, I was in the recovery area. And there was a lady there because they always have someone that, is watching to wait for you to wake up. So she comes over to me and she asked my name and everything and everything. So then she said to me, I can't tell you what took place. You have to wait for the surgeon to come out. So I'm like, okay. So then I tell her, my husband is in the waiting area. Can you have someone to go and get him? So she tells me he's going to meet you upstairs. And I thought that was strange because that's never happened during any of my surgeries that I've ever had. So I said, okay. So I'm sitting there waiting for this surgeon to come out to explain everything to me. what took place, or if there's anything changing, whatever. Surgeon never comes out. Someone comes over. She's like, oh, he's going to transport you upstairs. I'm like, but what about me finding out what all happened? So she tells me, oh, they'll come upstairs to talk to you. All of this is strange to me because I have never experienced this except for one surgery back in 2010, which that's a whole nother story. Um, so I get upstairs and I am upset because I don't know what just happened to me. I all I know is what they explained to me prior to surgery. What would what could take what they're going to do, and anything that they needed to do that they would do, because they were supposed to do something extra if it was needed. But nobody explained anything, came out to explain anything to me as far as everything that actually did take place during my surgery. So I get upstairs and my nurse is asking me, well, did they explain to you everything that happened? And I said no. And she's trying to ask me questions. At this point, I got tears in my eyes, like, and my husband already knew it. I couldn't even speak because if I spoke, I just began to have tears coming down my eyes. Like, I have no words for anybody. Like, at this point, I am livid. Like, I need some answers. Like, why is nobody telling me anything? Why is nobody telling my husband anything? So she's like, well, I know, but I can't say anything because protocol. The surgeon has to give her permission to speak um, as far as what took place. So she calls the surgeon to say, hey, are you guys coming up here, or can I tell her something? She's my patient. I can't just keep going in there and trying to have a conversation with her and not be able to tell her anything. So they finally told her, yes, you can go ahead and explain to her what happened, but we will come by after we have surgery. They had back-to-back surgery, which should not have mattered when you have a patient. Evan Health got to do better with this right here. When you have a patient, you need to hire somebody that's their only job, to go and speak with a patient. What if I was a patient that had high blood pressure or had heart troubles or had, anything that could trigger that, I mean, them not getting this information could have triggered that. Because I mean, I that put me in great anxiety. It just got me upset, and I didn't even have to get to that level. I shouldn't have had to get to that level. So, anyways, my nurse comes back in and she begins to explain. I actually did not even have the surgery. Here's what happened. When they went in to operate on what they thought was a boil, once they got in that area, they realized it was not a boil. It was an actual tear. And I'm going to insert a clip of the actual area so that you can see what I mean. So what they did was had me under anesthesia, and they did still send the camera inside so that they could get a bigger picture of what was going on even from the inside. So what happened on the inside is I actually have what is called hemorrhoids, and the tear is something that happens when you from straining, from my understanding, it it happens and it begins to get bigger. The tear becomes bigger until it becomes like a bruising on your skin. So I guess from me using the restroom, and I'm not a person that uses the restroom. I know TMI on the regular. I and I've been okay with that for years. But no, they are saying they want me to actually use the restroom at least twice a day, and that's with um, soft stools. I shouldn't be straining to get my stools out. So over time, that's what has caused this tear in my skin. It has caused like a redness in my skin, which made my skin tender to touch, which gave my skin a knot back there, and which gave the surgeons the thought of that being a boil. Because when they went to check, they said that even though they didn't get a good look, because I mean I was in so much pain, like crying pain, like screaming pain. So they would move fast when they went to check it, and they checked it several times, even lubricating the area and inserting their fingers to see if there was bruising at the entrance of the rectum or whatever. But they couldn't get, I guess they couldn't get like a full view until they actually had me under, and they would be able to do everything without me being in pain, which I'm going to tell you, I am very much grateful that I did not have to be cut, that I did not have to be packed with, that I did not have to be packed with gauze, that I did not have to have anything else done back there. I mean, I still am in pain. So the thing is now that they're going to give me some sort of laxatives to get everything that's in my system drained out. I have taken laxatives prior to me having surgery, and nothing was coming out. So the idea was that they were going to drain everything out when they did the surgery, but being that they didn't, after the surgery, um, they everything should start coming out of me, and that did transpire. Um, Everything that all the laxatives that they gave me obviously was already working in my system. It just couldn't exit out my body. But well, let me tell you, it exited and exited and exited and exited. Okay. So I am feeling better because there is no more pressure. And I think that was causing a lot of the pain, the pressure of the bowel and it not being able to come out because it was too compacted, I think. So them sending the scope in and seeing that there was the hernia and everything that was there. So moving forward, the plan is to get me on some sort of fiber to help me go. They would like me for me to go 3 times a day, but if I go at least 2 times a day, they're satisfied with that. And over the time, without me doing any more straining, that tear will actually begin to heal. And that is the only way for that tear to heal is me not straining back there. Y'all, I had no idea. I had no idea over the years that this is what has been happening back there. Like, I mean, I was going to eventually start doing colonoscopy. Colonoscopy. Is that how you say it? Colonoscopy. I think that's what it's called. you get what I'm saying, because I am 45 now, so I did plan on kind of doing that. I wanted to make sure, that that area stays clear, but I wanted to also wait until I had my PET scan, because when you have the PET scan, it'll show you any areas that are cancerous. And once I found that out, whether or not there are any type of cancer cancer cells anywhere back there, I would know how to move about my decision as far as getting one of those. So I still plan on making that appointment to go ahead and have that done, because it will clear you out, give them a chance to see if they see any type of growth back there. But first of all, first things first is to get this process right here healed, and then I will move forward with making any type of appointments. You guys, we have got to take care of our bodies. We are not getting any younger. It's a lot of stuff that is taking place in our bodies, and we really discard it. Like I said, I didn't think that me screaming when I get up from using the restroom, I feel better, and I had no idea if I strained or not, what that was doing to my body over time. Like, seriously. So I just wanted to come on here and update you guys, and I want to thank each and every one of you that prayed for me during this surgery, because I know it was from your prayers that God made the decision to not let it be a surgery. Because I'm telling you, this whole time, I'm going in thinking I'm going to be cut. This is what's finna take place. But I know I had some warriors out there on the battlefield for me. And I want to say thank you to each and every one of you. I really, really, really appreciate you guys. And prayer is real. Prayer works. Prayer is necessary. I hope you guys are praying for 3 people a day, so that you can at least cover a multitude of people during the month. Because 3 times 30 equals 90. And that's not too much to ask. But if we're all doing it, we are covering someone out there. And it is necessary. I'm going to go ahead and get off before I start rambling. But I want to say I love each and every one of you. I thank God for each and every one of you. I pray you all have a blessed, prosperous day. And again, thank you, thank you, thank you. Please subscribe if you're not subscribed. And please share this video. It really may help someone. You never know what people are going through. You never know. Sharing is caring. You care? Share. It's free. It won't cost you nothing, I promise you. It will not cost you anything if you share this video. All right.
To help relax the muscle there,
Okay.
and also numb it up so it doesn't cause pain.
Okay.
When that muscle is able to relax, it's able to heal. It's when it's constantly strained that it can't come together and heal well.
Okay.
So that's what the plan is. And then I need to follow you up to make sure that it's actually healing.
All right.
If it's not healing, we need to make sure nothing else is going on and might need to biopsy it. To me, this just looks like a chronic anal fissure.
Okay. Anal fissure.
Yep.
Okay.
I thought it was going to be pus. You know that little bump that was there?
Yeah, what was that?
What that was where it just was inflamed around it. It was just swollen. I thought there was going to be a pus pocket based on what I felt, but what it actually was off to the side, just a little bit off to the side, like this.
Yeah.
It was just inflamed. And it, like when you injure yourself, you get some inflammation there.
Yeah.
It just was firm, inflamed tissue. But there was no pus or anything draining out of that. I probed it to make sure it didn't connect somewhere, that we were missing not like a fistula or a sinus or anything, but no, nothing.
That is weird.
Yeah. Anal fissure. Now, like I said, we need to make sure that this heals. We do that with the cream and with your stool softeners.
Okay.
Give it time to heal on its own. If it doesn't, we need to be diligent about it, though, and make sure that it's not anything else. Yeah. So that's the game plan.
Okay, so when are we going to start this
just
process?
today. We put in the medicines.
Okay.
So fiber, number one, so make sure fiber does a few things. It actually bulks your stools, but makes it so you pass it nice and easily.
Okay.
It puts it in a form that it should just flow through. We don't want you having diarrhea, and we don't want you constipated. We want you in that happy medium. So as long as they can pass easily, that'll help this heal. And then that cream we put in yesterday, so hopefully at some point today they'll get it.
Okay.
Just to put on your bottom there.
Okay.
We also put in instructions for that, so when you go home, you can go to a pharmacy that can make that cream, just because it's not a very common cream.
Okay. I really was upset yesterday after the surgery because when I woke up, I'm in the recovery part, and I get the lady saying, did they explain to you do you know what happened? And I'm like, no. And she's like, okay, well, the surgeon will be out to explain to you. Next thing I know, she's like, oh, this such and such, he's going to be taking you up to your room. And I'm like, what? Wait a minute. I said, my husband's in the waiting room. And then she's like, oh, he's going to meet you upstairs. And I've never had something like this to happen to me after surgery. And I'm sitting here like, what is going on?
Yeah.
Nobody's told me anything.
That's my fault.
And then I get up here only for my nurse to tell me, oh, did they tell you what happened? And I'm like, no. So at this point, I'm so upset. I start crying.
I'm sorry.
And I can't. She's asking me questions, and I can't even answer it because if I answer her anymore, I don't know who I might become. And I just sat there in a blank stare, and that's when I believe she called someone, and they said, "Oh yeah, you can go ahead and explain to her." And my thing was, had I been a patient that had like high blood pressure, had I been a patient that had heart problems, had I been a patient that, I understand you guys are running back into surgery, but have someone in place that can explain that to someone.
I thought Dr. Sprinkle had come to speak with you. No? Okay.
And I only had that happen one other time since I've been dealing with chemo. In 2010, when I had my biopsy, I had that surgeon to not give me any pain medication. He had me to come 10 floors up only to meet my nurse saying, why are you crying? What's going on? What's going on? Oh, he didn't give me pain medication. I suffered the whole way here. Like, I've never experienced unprofessionalism, disrespect since that time until yesterday.
Well, I'm very sorry you felt disrespected. In the end, that ends with me. I should have come and just spoken with you personally. I thought one of the residents was coming to speak with you. That's my fault, and I apologize.
Yeah, I just wanted to express that to you.
Absolutely.
That I'm glad I'm not a person that could pass out or have anxiety and have a heart attack or something.
Yeah.
You know, you just got to treat your patients a little better.
Sure. No, of course. I always try to treat with due respect. Yeah. I feel like I have.
Well, I'm just speaking about yesterday. You've been very nice to me. I mean, until yesterday, I just didn't like that.
I'm sorry.
Okay.
I'm sorry. It's my fault.
Okay.
All right. I'll do better.
Okay.
All right. Do you at least understand what happened and what's going on then?
Yeah, I understand now.
Good. All right.
Yeah, now it's been explained to me. Even yesterday when the lady came up here, I just was still upset about the whole thing that nobody...
Yeah. Well, part of it is this. You know, you're sleeping in the recovery room, so we want to give you a chance to wake up. You know, some people take hours.
No, at this point, I'm asking the lady, like, what is going on? Right. Even when the nurse came back and explained that I didn't have surgery, my husband was over there clapping and all happy.
he was happy that I didn't have to get cut.
Well, we did an inspection essentially. We
Yeah.
call it an exam
I
under
mean,
anesthesia.
We could have came back up here happy.
Yeah.
I should have been happy, but I was already in the state of crying and upset and upset.
Sure.
So it took me a while.
Yeah.
I'm happy now. Today,
Good.
I'm happy.
Good. Yeah.
So
Part of that,
yeah.
I've talked to many patients in the recovery room, and sometimes they forget too, because you have a lot of drugs in your system at that time.
Mm-hmm.
I should have come to you afterwards. That's
But
my
even
fault.
if you would have came and my husband's there,
Yeah.
at least he could have reiterated
Reiterated that to you.
You know
Yeah. No,
what
I
I'm
hear you.
saying.
No.
Yeah.
Well, like I said.
When I came to, he could at least told me.
Yeah, of course.
You know.
That's my fault.
Yeah, it's just what I'm saying.
I'm sorry.
Yeah.
I'm sorry.
But I'm happy.
All right.
I am.
Good. I'm sorry you had a bad day. That's on me. It should have been a good day.
Okay.
Friends?
Yeah.
Okay. I'm sorry.
It's okay.
Well, take care. I can check on you again tomorrow if you want, if you're still here. And then,
Okay.
yeah,